Botanicals for the upper respiratory conditions. As per the name implies, the common cold is the one of the most frequent infectious disease in the human. It's a likely encounter patient seeking relief from these symptoms on daily basis. In this video, we will discuss some of the most common botanical uses for colds, sore throats, influenza, and allergic rhinitis. It's really important to note that botanical for cold and flu symptom need to be started within 48 hours of the symptoms. And in themes and honey, all may help alleviate symptoms of the common cold. A symptomatics review performed in 2004 on 7 trial involving 896 total participants on the effectiveness of andrographic in alleviating cold symptoms led authors to conclude that andrographic is generally safe, superior to placebo, and has a preliminary evidence for the preventing effective on upper respiratory tract and respiratory organs. Uh, Result conclude that SEG ischemia spray was effective and well tolerated as the chlorhexidine lidocaine spray for the easing the pain from sore throat. This is likely due to anti-inflammatory, antioxidant, and antimicrobial properties. Elderberry, the ginseng clinical promise in treating influenza symptoms. By now, you are probably well aware the versatility of ginseng. It may have the ability to help the body fight fatigue, boost immunity, and combat the effect of stress thanks to its adaptogenic and anti-inflammatory properties. Now, a study conducted in 2004 on a group of 198 nursing home residents revealed lower incidence of both cold and influenza in the group receiving ginseng as compared to placebo. I do have the throw a word of caution here. Now, while there are the potential for botanical to help with influenza symptoms, and will most people recover from influenza without complication. The virus is responsible for approximately 20,000 deaths each year, in particularly among the very young and very old peoples, those who are immunocompromised, and those who have a type of weakened immune system. So please avoid using botanical in this population. Well, always advise all patients like to seek immediate medical attention if symptoms are not improving and worsening. Butterberry is a natal may is allergic rhinitis symptoms. A small double-blind study published in the Journal of Allergy and Clinical Immunology concluded that butterberry extract is more effective than disloratadine, which is standard pharmaceutical or antihistamine. While larger studies are needed to assess its effect. Butterberry is certainly a herb with promise with relieving upper respiratory system. Please recall that butterberry must be avoided in many patients, and population is that important for the pre-product prevent liver damages.